What'd you say?
I'd like to call this village board meeting to order. It is 7:40. It appears that all trustees are present, except trustee Carpenter, who has been excused. Clerk, has this meeting been publicly noticed?
It has been noticed according to law and posted according to law.
Okay, thank you very much. Our first special order of business tonight is very exciting. It is to meet our Shorewood Loves Dog mascot, winner Micah.
Stand up. Come on, we'll come over here so you can see our mascot. This is Jackson, the dog's helper, and Natasha, the dog's Micah's owner. And very, very friendly dog.
Do you want to say your name?
Oh yeah, sorry, I'm Ellen Ekman. I live in 2500 East Beverly Road, and chair of the Parks Commission, which in collaboration with the KW of the Shorewood Waterworks came up with this concept of a mascot to help us publicize the idea that Shorewood loves dogs, but we really love responsible owners, and that we want to use a very positive education approach to make sure people, owners of dogs, understand the ordinances, and also we begin to address through education the issue around disposal of dog waste, which is so we came up with us working with Kay. We came up with this idea of a mascot. We had a great time on the committee selecting our mascot a couple of weeks ago, and Micah won, and here she is. And you've seen her picture, which is a beautiful picture. And the committee meets, and we'll be talking about other ways to have her participate and help us educate. And one of the sort of interesting side things is the veterinarians in town have been very responsive and very helping us promote this. So we're working with them too. So it's sort of a novel idea that we're happy about. We've got some good press too. UWF followed us. So does anybody want to ask Mike any questions? She's a rescue dog, 3 years old.
Wonderful. We were just hoping that the board could come together and we'll take a quick picture.
Oh, that's a great idea.
We'll carry on with the meeting, so we'll just take 1 minute. Oh, for the update of the watch. Okay. All right. You and too. Where's your treats? I know. Micah. There we go.
Oh, that's a good one.
Okay. Here we go. 1, 2, 3.
Oh.
Nathan, don't you want to be in the picture? Sit.
I can't whistle. Does anyone know?
Oh, there we go. Okay, ready? 1, 2, 3. Thank you. Thank you.
Nice to see you.
North Shore Health Department annual report and service delivery deployment. Very good.
New words here. Thank you. So this presentation, I appreciate your time.
I hope you have fun with this.
My intent is to cover 2 of the areas of the health department. One is to provide you with some of our 2018 annual report numbers, but then also talk about those numbers in the context of our service delivery and how that model is changing and has changed over the last 10+ years. So I provided a report for you in your packet as well as some slides that we'll go through. And I started by grounding us in the mission of the health department, which is to promote, protect, and serve the communities in the North Shore. So you can move on.
Yep.
So as I said, I'm here to share with you about the North Shore, how the health department serves both Shorewood as well as the communities more broadly across the North Shore, and present some trends that are impacting our service delivery both at the national level and the state level, and then to raise your awareness about how those trends are impacting how we deliver service and the current model that we're structured under, which is the 2 offices. One here is in Shorewood, as you know, and one is up in Brown Deer. And we'll talk about that as we go through this. Next slide. So in terms of the services we provide, and I know that many of you have heard my presentations before, but again, I like to use this model to help people understand how the health department serves people. Because oftentimes I'm told, I don't use the services at the health department. How does the health department serve me? So I created this framework to describe how we provide services to individuals. They come to our clinics, or we provide direct services to them. And those are the things that you see in the top part of this pyramid. And then we provide services for the North Shore specific municipalities. That could be one specific municipality, or it could be a multiple number of municipalities in the North Shore. And some examples of those programs would be our communicable disease investigations. So we receive reports about varying communicable diseases, and we follow up with the investigation, of course, to control and prevent further disease spread, as one example. The bottom of the pyramid is what we're going to talk about a lot more today in terms of the work that we do that impacts the entirety of the North Shore. So it's not community specific, it's not individual specific, but it really crosses the breadth of the whole population. That's what I'm here to talk about, and that, again, how our services are really moving from those individual-based services at the top to this much broader framework for addressing population and public health impacts. So the trends that are impacting not just the North Shore Health Department, but health departments across Wisconsin and the country. One really big one, and again, as we talk about immunizations as a core area of what we've done in the past, the CDC in 2014 changed their Vaccine for Children program law, which was a law under which we received vaccinations from the federal government passed through down to the state to us. Prior to 2014, we could vaccinate anybody that wanted a vaccine, regardless of their insurance status. Well, this law really changed our delivery because it prohibited us from providing vaccines to people who are covered by other insurance, be it public insurance or private insurance. We actually think that that's a good model, and that now what we do, instead of providing a vaccine for somebody, is recommend that they see their primary care provider so they can have an established medical home and get immunization services in the context of other wellness care. So it is a model that is one that we advocate for, but it means that our direct service delivery in terms of vaccination has gone down over the years, and you'll see that impact. The Affordable Care has obviously increased insurance coverage for people. Again, a good thing that's happened, but it impacts what we've done and how we provide services. We're no longer that, what maybe someone think of as a safety net healthcare provider. You know, there are federally qualified health centers that do that, and that's not our role anymore. And then again, on the national level, public health and healthcare research is really understanding more of the scope of what impacts quality and quantity of life. And healthcare and clinical care is really a very small percentage. We're talking more in terms of social and economic factors, the environment, people's health behaviors is having much more of an impact than direct clinical care. So again, a trend impacting our service. Then there are trends in Wisconsin that are, again, having an impact. One being the rules are changing for local health departments. So state statute and DHS administrative rules have really changed what we're being asked to do in terms of services. One really key example of that is community health assessment. So doing a deep dive into the health issues in a community and creating a population-based report on what those that health assessment says, and then working with community to create a community health improvement plan to address community priorities. That's a really big scope of work that looks very different than it did, I would say, 10 years ago. So again, that's an example of how that rule change has affected what we do. And then grant funding has become available for local health departments that are looking at community health improvement initiatives that are, again, much more broad. One example being our fall prevention work that is touching more on the community level as well as the population level, and where we've been able to successfully receive grant funds because of our work in this area. So how, this next slide is my attempt to, again, provide a framework to show you what the health department looked like in '96 when we had a current agreement. And then, if you recall, we just passed a new service agreement in 2018. And these are all of the elements in that new service agreement. Again, state statute driven, national driven, as well as community priorities. My color coding, the green shows you what was current in what was in '96 and what's current now. So a lot has stayed the same. And then other things have changed. And then I guess I have three elements to this. The blue, or the green, is really what services occur directly in the office. So the intent here is to really show you that what we do is happening outside of the office, where we are going out into the community instead of people coming to us directly. So flipping a little bit more into both our 2018 numbers as well as some of the current trends and how they're impacting our service. So one, again, I want to highlight is the immunization program that we provide. So in looking at our data from 2015 to 2018, and the North Shore Health Department has never been a big immunization provider in the area, say the city of Milwaukee being a fairly large immunization provider. But you can see the trend over time is very clear in that the number of immunizations we provide is really going down. We still provide an important service. There are still uninsured people in the North Shore that need access to the vaccinations that we provide, but the number and the trend is going down. So in terms of Shorewood, about 38% of the vaccinations we provided in 2018 were for residents here. Second from there is Glendale and then Whitefish Bay. We keep most of our vaccine stock in the Shorewood office because that's where our pharmaceutical grade refrigerator is located. So more of our vaccines are given out of the Shorewood office. So it's kind of we've created the demand by having the supply in Shorewood. So flu vaccine is separate because our trend is going in a different direction, but there's a reason for that. So you can see in 2018 we provided a lot more flu vaccines than we've ever provided in the last 4 years. And that's because we really increased the number of clinics we provided outside the office. So again, from the perspective of we're going to go meet the people where they are instead of just having clinics in our offices. So we provided and hosted 20 flu clinics throughout the North Shore in 2018 compared to only 10 in 2017. A lot of those were in each of the villages that we serve, so we provided vaccinations for the staff of the municipalities as well as the North Shore Fire Rescue. And then senior centers, we provide vaccines across the region as well as other places, the schools, some of the schools we provide vaccines for if they ask for it as well as other places. Usually if a community requests a vaccine or a flu vaccine clinic, we're willing to accommodate people for the most part, depending on the number of people they have. So again, I'm here to talk about the office as well. So 20% of our vaccinations were provided in the office of either Shorewood or Brown Deer. The majority of those, 20%, so about 74 flu vaccines were provided directly out of the office in Shorewood. So those could be walk-in people, those could be at any of our hosted clinics. Again, we keep the stock in Shorewood, so it does make sense that people are coming to Shorewood. But that's the structure that we have. So most of our, my point being, most of our flu vaccines are provided out of office. Where I really see the impact is our blood pressure screenings. That's a program that's kind of ebbed and waned over time. You see, again, we provided more blood pressure screenings in 2018. A lot of that is, again, because we provided more blood pressure clinics outside the office. So we added Brown Deer as a location in their senior center, as well as the LX Club, which is the Fox Point Bayside Senior Center. But in terms of the impact, the residents of Shorewood really do utilize that blood pressure screening. We host a clinic Wednesday in the late afternoon. We see a lot of repeat people week after week. Sometimes they come for, a spell of time when they're going through medication adjustments. Sometimes they come for the duration of they're just regular customers. We do try to keep people to the clinic schedule, but we do get walk-ins for blood pressures now and then too. So you can see the trends there. They're really kind of, staying stable or going up just a little bit. So I want to move a little bit more into kind of how else we serve the community. I work with a friend of mine to create this, again, this framework to show you around the clock what we're doing, and we're up and out of our seats so much that it's really exciting to be working at the health department because we're involved in so many wonderful things. And I mentioned fall prevention, but we're part of the opioid fatality review. We are working with the county department on aging to host a Chapter 55 training. I mean, our work is so expansive that it's just a really exciting time to be part of a health department in Wisconsin. The flip side of that, again, is that the office structure really is a challenge for us to kind of maintain that office hours of 8 to 4:30 in 2 locations. But again, my point with this is just to give you a flavor of how we're in the community every day at all hours of the day. So just to dive deeper a little bit more into the challenges we face. So as I mentioned, we have 2 offices. The Brown Deer location is our primary one. They're our fiscal agent. We have all the phone calls routed through Brown Deer. And then we have a smaller office down here in Village Center. We maintain staffing or aim to from 8 to 4:30 for both of those offices. We only have 8 people on staff. So that can be very challenging in a week like last week where somebody was at a national conference that they received a scholarship for and somebody was on vacation. So the point is that we're doing our best to keep it open, but there are times when we are in a position where we have to close it. Now, we do work it out with the community. We let people know at Village Center and Village Hall when we're going to be closed. So there's good communication. We never close if there's a clinic time. We're always available during those times, or if there are other needs for us to be there at certain times. So I feel like we're maintaining good levels of service. And my point is just to tell you of the challenge and that really this changing nature of the health department is going to make it so that the door may be closed, but the service is there and the department is open at all times, actually 24/7, because we're an agency that responds up to some of the things that we're doing to enhance our services, though, is, again, the phone calls are all routed through Brown Deer. Everybody's available on their cell phone, and our office lines are directly connected to our cell phone. So if you called my Brown Deer number, I get it on my cell phone here. So I'm reachable at any point in time, and that goes with all the other staff. We've created connections between our computer networks, so now we're on a cloud-based server, so our computers can talk to each other, which is new, 2018. So, we're trying to think about how to be efficient in this changing environment. But again, it's important for you to understand that this is the environment that we're in right now. So the long-term impact, I see it as expanded services and a better benefit and improved population health for Shorewood residents as well as the North Shore more broadly. Short-term impact in terms of positive, our visibility has greatly increased. I get fewer people saying, I didn't even know we had a health department. And to us, that's a great thing. The negative is that our on-demand availability has gone down. So if somebody were to walk in at any point in the day and want a blood pressure question answered, they may not be able to get somebody right then and there. So that is the reality of what we're facing now. Now, there are other places for clinical services for the blood pressure readings, so it's possible that those services are provided elsewhere. But again, that is the reality. We try to minimize this by posting our clinic times, making our services available, and clearly communicated to people through the village manager memo, through other resources, so that people know when we will be available and when we are available. And then obviously we'll continue to always offer appointment-based immunization and blood pressure clinics as well as the walk-in programs. So I rushed through a lot. I know you have a lot to do tonight. I'm not gonna go through my last couple things, that's just a snapshot of our annual report information, and you'd be happy to answer a question about that too. We have a full annual report that comes out later this month that I am happy to provide too. I know Rebecca has posted in previous years, so you can read. It provides a really, in my humble opinion, a great narrative about all the programs, so you can get a deeper dive into, what are you doing in this area, or how does this. So I'll conclude and answer any questions.
Well, first I'd like to thank you. That was one of the most comprehensive presentations I have gotten in about a 10-minute period or less. So thank you so much.
Sure,
It was
yeah.
very helpful. Does anyone have any questions? I have one, but I want to wait until the board. Trustee McKay.
I just have a comment that I've had the pleasure of collaborating with you and your staff on a number of occasions, and it's always incredibly impressive how responsive you are, how open and knowledgeable, and you can quickly align with whatever the opportunities are. And I just want to say again, thank you. It's been a real pleasure.
Trustee McKay. Trustee Menta.
I had a question about opioid
Sure.
deaths and overdoses.
Yep.
What are the trends that you're seeing? Or give us an update on that in our community?
I have two answers. One is the trends for 2018 are stable to 2017. So we don't continue to see that rise that we saw starting in 2015, that it was going up 2015, 16, 17. It's somewhat flattened out. That doesn't mean that the issue is definitely not critically important to be continuing to work on. That being said, we're partnered with the Milwaukee County Opioid Overdose Fatality Review Committee, and we're starting a North Shore Fatality Review Committee so that we can dive deeper into our North Shore cases. We got grant funding to do that starting actually in 2019. What that'll do is create a set of local recommendations to tie systems together for things like handoffs from emergency departments to communities or to peer support specialists. So there's a lot of activity happening in that area, and finally some funding to do something about it.
It would be, whenever you see that trend declining, let us know. I know they're cracking down on doctors and prescriptions, and so you would assume that it would be leveling off, but
Right.
it would be really good to know when it starts going
I
back.
would actually argue it's become more complex as an issue in terms of overdose poisoning deaths are opioid related, but we're also seeing a lot of concerning trends in other drugs. So in terms of our fatality review, learning about the mixture of cocaine and opioids, of cocaine and heroin, methamphetamines. And obviously fentanyl is still the continuing concern. So these overdose cases continue to become more complex as we learn more about addiction and how to address the issue.
Thank you. I had just two questions. First is for blood pressure, it looks like that's the biggest effect for our shore walk-ins. And is there going to be some sort of maybe manager's memo or some sort of reach out with the whoever's the major population that's coming from shore
Sure.
For blood pressure? Is there an increased effort for that?
So in the manager memo, we always post the clinic times for that. In terms of communication with the Senior Resource Center, we're constantly talking with them about when we're available, when we're not available for people who need those services. So it's been a situation that's unfolding, and we've been dealing with it for the last year or so. So I don't know if it's necessary, and maybe I can talk to Elizabeth about her feelings on this, but to post something specifically that says, hey, we may not be available, versus one of the assessments that we're going to be doing is looking at the clinic times to make sure that those match up with the Senior Resource Center activities. I'm wondering if that Wednesday afternoon is the best time. That's when we currently offer, or whether we offer a shorter clinic during other peak times. And we can talk with Elizabeth about kind of doing a quality improvement assessment to see if that's the case.
And then finally, as we always are space constrained, and we've been talking through here, is just where is the health department going to go?
Yeah.
We need two offices. Do you see? I know Trustee Marver has explained some of the history at one of the presentations, but where we really felt it was important to have a short location clinic because of all the walk-ins. And is that still because so many were provided an outside clinic, do you still feel that's the absolute need?
I think in terms of efficiency and function of the health department, a one-office structure is the best structure for us. I think that as Rebecca and I have talked with the other managers, the complexity of that discussion is wrapped up into our formula discussion, and so it becomes a very complex discussion to have at this point in time. I think that we'll continue to nudge it and see where people are, but I don't see at this point that there's any progress there.
Thank you. Trustee Baca.
And I was wondering for your presentation during our committee meeting where we were discussing the conversion therapy ban and the role of the health department providing a bunch of research and resources. So we're very blessed here in this village.
And we're happy to do that. Again, as you look at changes, that's one of the roles we enjoy playing. So,
Thank you.
And thank you so much. If there's no further questions, have a fabulous night. Thank you. On this, do you have questions?
No, but you omitted the public comment portion of the meeting. And I wanted to know whether the meeting was it's not listed, although.
Number 7.
Number 7.
Is it? I'm sorry. I said it at the beginning of, my mistake.
Citizens to be heard.
Oh, right, sorry, number 8.
Yeah. And let me just explain really quickly, and I do want to speak with the village manager, maybe putting something up here, but if there's if there's ever a question on an item, we always let the board, it's just protocol to speak on an item first and discuss it, and then if there's any residents, I would gladly call on them, and please help me as my board members, that if you see a hand and I don't recognize it or I miss it, please let me know. So maybe we can outline that. In addition, our new village manager has rearranged the agenda, so if there are presentations from outside parties, she puts it under special business, and so that moves it up so we don't have to sit through everything, but we could talk about where the public, because the public now sits through more than they have ages. So I appreciate that. It's just further down in the agenda for a minute.
Thank you.
Okay, so our next topic on the agenda is the consent agenda. Do you want to have a motion to approve?
I move to approve the consent agenda.
Second.
A motion and second. Any items to be removed?
I'd like to remove item 5B,
Please consider village board meeting minutes. I just wanted to remove B. Consider RFP for insurance broker. Any others? If not, we have a motion and a second. All those in favor, beyond with the omission of B and D, say aye.
Aye.
Any opposed? Motion carries 6-0. We'll now take up each removed item. The first is 5B, consider village board minutes from March 18, 2019.
Okay, on page 8, my question was concerning the discussion around the crossing guards. And if you all remember, we had quite a few amendments, friendly and otherwise. So it's a little murky here. And my question, so if you haven't read this, I guess we could start on page 7. We were talking about a variety of things, including hiring, whether to hire 7 crossing guards at 50, or which would be a cost of the village of $16.14 per roughly. And then, anyway, my question goes down to the last paragraph, and this is midway through the page with page 8, which talks about the motion as amended, and it says 3. So the motion as amended, 3, with friendly amendments. President Rozak moved, seconded by Trustee Menta, to temporarily hire the 11 guards at $15 an hour with an estimated cost to the village of $16.14 an hour through June 30th, 19, and to direct staff to bill the Sherwood School District their portion of the contracted crossing guards. Motion carries 5-2 with President Rozak and Trustee Menta voting no, or nay. So I guess my confusion in this is, it says that, go ahead. With that they, which part of the amendment is this referring to? Because if memory serves, it wasn't
Correct.
that you two did not propose the 11 crossing guards at 15 an hour.
When we proposed the original motion, yeah, I have a lot of questions on this too. Like on page 7, where it says President Rosa moved, seconded by President to hire 7, and then it says no vote was, a couple places says no vote was taken, and I think we have to take that out, because we did take a vote. Yeah, so as I recall, and I did watch the tape, the motion was to hire the 7. Then it was amended to increase to 15 an hour. And I voted yes on that, so that vote is wrong. Amendment carried 6-1 with President Rosa voting nay. Okay, then take out no votes taken, take out no votes taken. So then there was a second amendment to go from 7 to 11. We voted against the 11, but the original motion was still our motion that then was meant. You know what I mean? So the original motion is still the motion that President made and I seconded, but it had been amended.
But it still, Trustee Bachman, the motion as amended, President Rozak moved and seconded by Trustee Miller is not correct, because as amended,
Right.
I wouldn't move that.
The motion as amended, what do you mean?
The page 8, third,
Just say the motion because we already discussed the amendments.
no, someone, the motion as amended, I guess we need to turn out, I don't know how that is supposed to be, but it reads wrong. I mean, it looks like that I moved to make the motion as amended and then voted against it.
There was a second on the amendment, and there was a vote taken, and it was not reflected in the minutes. Is that what you're saying?
The amendment was voted on, and that's correct. And then the motion as amended.
But the original motion was still your motion, because that motion was amended twice, so you still were responsible for the original motion.
Is that correct? I've never seen that.
Well, technically, because as long as the amendments were voted on properly, which they were, that's the original.
As amended.
As long as it's reflected as an amendment, and you could follow the fact that it was different from what you originally proposed, if that should concern.
But I mean, shouldn't the minutes just say at the beginning, I mean, you moved it, and you made the motion once, you didn't make the motion twice.
Right.
I mean, if you look at the
Yeah,
first
just take
motion
out.
made, it was moved by President Rozak and seconded by Trustee Mentor.
Right. So I think it would be clearer if we struck, so if
Yeah.
we propose to say the motion as amended to temporarily hire the 11 crossing
Yes,
guards,
yes.
just take out the
Yeah.
original motion maker,
Yeah,
which I've never seen before, because you've already stated we made the original motion.
right,
And then it doesn't look like we made the motion again and then voted against it.
right.
Then the motion with the friendly amendment, that. Trustee Barton moved to. And there was one other one though, besides striking out the no vote was taken, there was one that was wrong. 'Cause you
Right,
voted-
yeah, the vote on the $15 an hour, I voted for that, so that's 6-1. I voted 6-1.
On the
President Rose
amendment.
voted no.
Correct.
On that final vote?
No.
No, the first amendment on the pay, $15 an hour.
So on the top of page 8 there, that
No,
vote?
on page 7, 4 paragraphs up from the bottom,
I see where you're talking about.
okay?
Okay.
Yeah. Is there anything else, Trustee Bachhorst, that you noticed that you want to change?
No, it's just, yeah, thanks for the clarification, still, so yes.
Okay. I did have two questions, unless there's others.
Yes.
Oh, Trustee Menta and Trustee Mongery.
On the committee of the whole, item 4, the minutes seem to reflect the board report as opposed to the board discussion. And I watched the tape today, and the board discussion was about the board role in requesting research and recommendations from committees. But as I emailed, I think I'm looking back, I'm not sure if this, I I'm not sure even what we were discussing. I mean, this isn't policy in development or existing policy. It wasn't really, it was just kind of presented as a agenda item, and So
Yeah,
I would
I don't
say-
think the title of the agenda item was volunteer committees, it was annual planner, was it not? And that was part of it?
The title was discussed next steps for volunteer committees.
If the, and meeting 7, we didn't have 7 meetings on volunteer committees.
Right, it was a component of the standard committee policy.
So what I think, and I would like to keep titles of agenda items the same, if we're gonna put it's the same, it's a 7th meeting for something. Only because I got confused too,
Sure.
because I missed a meeting in between these standing committee meetings that we just had today, that's committee of the whole. And somewhere it went into volunteer committees. So that was the finalization of that conversation, whatever that conversation was. I do agree with Trustee Amenta that that was one of my comments is minutes, I mean, we all have the memos, they're all public record already, so the minutes should reflect the discussion and not the language that's in the memos.
And yeah, the substance of our discussion was what is the board's role, and because we ask committees for recommendations or for studying things, and there has to be a way for us to be able to still have that ability to do that.
Correct. I think it was a good recap. I do remember Rebecca providing a recap, so whatever that recap was, but then the substance of it from the board was, well, what do we do if the board would like to pass down, a recommendation to work on something, and that's not reflected in here.
And the only other one I had on page 3 under B, consider the service agreement, the administration charges for Eric's time, I think we should say Mr. Dixon. And that's all I have.
Trustee Moore?
Yeah, on top of page 2, the second paragraph, when we came out of the closed session, it says the vote motion carried 7-0. I believe it was by a roll call vote required. And then on page 7, the second paragraph, it refers to village hall employee would cost $60. It should be probably an hour, just to be clear.
I'm sorry, Mike, I'm still, or Trustee Maher, I'm still catching up. So
Okay.
what section was that?
Page 7, second paragraph, it refers to $60 for village employees, which is $60 an hour.
Per hour, so it includes per hour,
Yeah,
that?
yeah.
Yeah.
And I'm staying on the open rule just quickly, I just noticed there was another space where it says the original motion as amended, President Rozak moved, we could strike that again, just in order to see it moved. I think it's the, third sentence from the bottom of page 7. I would just say the original motion as amended, temporary hire 7 crossing guards.
Yeah.
So that was just another spot.
Okay.
Actually, if I'm right.
Wait, so what are you asking me to do?
On page 7, the third paragraph up.
Yeah.
So similar to what we discussed on page 8, say the original motion as amended, and then you just strike President Rozak who seconded, because that's the original. You just say to temporary hire, blah, 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 and then you just say the vote. Well, if there was a vote, you take it, no vote was taken. Unless no vote was taken. Any other comments? I just have one. Anybody else have any? Okay, for the agenda, that's what people search on, and I know we mentioned this last time, when it says under 5B, consideration of village board minutes, March 18th, can we also say and committee of the whole minutes? And the reason I say that is, as we're going through our policies, committee of the whole is a committee, and I want to make sure when people are searching for committee of the whole, they know that's what minutes would be, even though it's the full board, it's not a village board meeting. So that would be my request. Okay, so if everything's done there, is there a motion to approve?
Move to approve the amended minutes of March 18, 2019.
Second.
Okay, we have a motion and a second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? Motion carries 6-0. We'll now take up 5D. Consider RFP for insurance broker, I was just looking through the minutes, and it's not reflected in the minutes, but I was told by a trustee, did this go to Jake, you know? Where did this go?
Yeah.
Okay, yeah, it was for the chair of the committee. I asked how it went, because I wasn't able to attend that committee meeting, I was in a different one, and they mentioned something about this collaborating with the school board, and then they did notice in the memo that we're on different budget cycles potentially for insurance.
Open enrollment cycles.
Open enrollment cycles, and so I just want to understand that a little better, so maybe not for this one is okay, but what does that mean?
I think the
It's called out.
discussion was that was gonna, because of the different times of our budget and when open enrollment would be and the different plans that we have, that it's something we would probably need to put on like a 3 to 5 year timeline to have further discussions about, just because we're so different right now, that there would need to be some, you know, movement on either side to combine, and that it was probably something we weren't going to be able to do in 2020.
And so this RFP will be a 3-year contract?
Right now, we have it spelled out for 3, but we'll see how we
Okay.
go through the process. It may not end up being recommended that, but that's how we would start 3 with a 2-year.
Okay, so I would just ask, whenever, I don't know if it's the right spot, but as we go over the next 3 years, we don't lose track of that. Sometimes we say, oh, we're going to do some information, and then we don't assign it to a committee, and we get to the, you know, the next cycle, and it's like, oh, we don't have enough time, I've seen that happen, so it just, I don't know how we know that, but to understand that, and also it's another area of improvement for the minutes, and as we do committee meeting minutes. I know that was the discussion, and I didn't see it anywhere, I just couldn't find it, so. Okay, does anyone else have questions on that?
I move to authorize staff to issue an RFP for an insurance broker.
Second.
Okay, we have a motion and a second. Any further discussion? Seeing none, all those in favor say aye.
Aye.
Any opposed? Motion carries 6-0. I take it when we don't say aye, that means yes, right? All right, so that.
We already did that. Okay. So you can go to number 7, public hearing.
Okay, so today there's a public, number 7 is public hearing. We do not have a public hearing listed on our agenda today, so we'll move to number 8 for citizens to be heard. The gentleman just walked out for a second. Okay, so, sure. So citizens be heard, this item is for matters that are not on the agenda. Discussion may follow, comment on non-agenda items, or discussion and action may come at a future meeting. If you could just state your name and address.
My name's Renee Verzin, 4090 North Lake Drive. I'm here with my husband, Renee Burkhart. So it's listed under 11A, but it says item for future consideration. So is that to be talked
Go
about?
ahead.
Okay, so it's the consideration of Airbnb, and I know Joe Bachman, our neighbor, sent a letter on it. We have a property across at 4079 North Lake Drive that is advertising by nightly stays. And there's parties coming in and out nightly. And I guess, you know, I just think that's more like a hotel. Nightly stay sounds like a hotel. So I don't think that's appropriate for the zoning. Certainly not why I moved back to Shorewood after being a Shorewood graduate and growing up here and being an intermediate school and a high school graduate. Brought my family back here, and it's for good schools and a safe community, and not to live next to a perpetual party house. So that's what's going on, and we make policy and get fixed.
Thank you. And I believe
You want to add anything on that?
email, just so we're sure.
No, just probably an update what happened
Oh, can you
on
just,
Saturday. We were just coming back from a trip and saw there was a huge coach bus parked opposite of the street. The coach bus with running engine was still sitting there 2.5 hours later, still with running engines. And in this RMB property, there were probably 40, 50 people in this building. I got an email once we were on vacation that our property the week before was devastated by garbage, which we usually don't have. That was all in front of our property, also in front of our neighbors' properties. And this is from this RMB Airbnb building, rental property.
Thank you for that information. Yes, if you just come to the microphone and state your name and address.
My name is Myers. I live at 4085 next door to 4079. I wrote a letter of protest almost a year ago to the village complaining about this Airbnb, which appears to me to be a clear violation of the zoning law. During this year, it's about 10 months, I guess, since I wrote the letter. Exactly nothing has happened. I checked with the department and they say the village is working on it. I don't know what there is to be worked on, actually. We either have zoning laws or we don't. We either enforce them or we don't. As a taxpayer and citizen and all that, I think we are entitled to some protection under the law. And I think the village should issue an order to stop this. If I started a pig farm in my backyard, I don't think it would take the village very long to act. That coach last night was parked in front of my house with the engine idling for about an hour or so, I don't know how long.
It was a couple hours.
And we have cars parked all up and down the street virtually every weekend. Multiple people going in and out of next door. It's sort of a constant stream. And this is not having a good effect on the neighborhood. It's a good place to live. I'd like to keep that way. Thank you.
Since this was a request, it went to staff, can we just get an update on can it be forced? No, I just asked. I didn't know if I could ask a question.
I can just provide a brief update, and I have worked with Mr. Myers over the past 10 months. As he's indicated, where I come from in terms of what I can do is, I'm not physically in the office Sunday night at whatever time it says. I've advised residents to call the police so that we can document that this is taking place. From a zoning enforcement standpoint, I need to have some sort of evidence or proof of who is staying there and under what terms. The state statutes do not allow us to enforce an outright ban on tourist rooming houses if in fact the stay is for a certain period of time or longer. And so where we've struggled in terms of being able to adequately enforce this is having proof of who is staying there under what terms. So I definitely sympathize with the situation, and I fully agree that it is happening. Both myself and the health department have talked to the individual who owns the property. He's indicated that he's not doing it, so at this point it's his word against ours. I definitely believe our word and the word of our residents in terms of where it's coming from, but in terms of being able to enforce anything, I will need to have documented proof. And so that is where I've continually requested that the police be called so that the police can go there, get a statement of who's staying there under what terms. If it's a parking violation, if it's a noise violation, things like that. And so I think it might be a matter, and we can discuss it in the item that's coming up, it might be a matter of identifying with, various departments what steps are taken under what circumstances, just because I said these things don't happen when I'm in the office, unfortunately. They happen on the weekends, they happen at night. And I just need that proof that I can then send a citation or enforcement that our attorney can then back up in court if needed. So, and Ethan probably can provide further direction on that as well. But that's just my quick perspective of where it's standing.
Thank you, and we can have further discussion in items of future agenda. I just want to make sure we have a response.
If I can add, I haven't been able to look up this property number, but people who looked it up, property number